As always, I'm excited to have you join me for another episode of Optimal Anesthesia, and today we'll be discussing something very important: the typical adverse effects of opioid drugs. Although opioid painkillers are very effective, they are not without their drawbacks. In this segment, we'll examine these results, with an emphasis on morphine's influence. First, it's important to understand how morphine affects your heart before you start taking it. Because of its influence on the sympathetic nervous system, morphine may lead to orthostatic hypotension, or a dip in blood pressure while transitioning from laying down to standing up. Bradycardia, or a slowing of the heart rate, and the release of histamine might have consequences for patients, including hypotension. Now let's talk about how opioids affect our respiration, which is very important to know. Opioids may cause a reduction in breathing because they inhibit the centers of the brainstem responsible for breathing, making us less sensitive to carbon dioxide. On the other hand, pain may override this depression and result in faster breathing rates. Opioid overdose has the potential to induce life-threatening apnea. Let's move on to the effects of opioids on the brain and nervous system. Sedation is a common side effect of opioids, and it may occur before any pain relief is felt. Muscle stiffness, especially in the chest and laryngeal muscles, may result with the rapid intravenous delivery of opiates like fentanyl. Even the electroencephalogram, EEG, may be influenced by morphine, with effects comparable to those of sleep. A typical adverse effect is miosis, or narrowing of the pupils. But what about those who have suffered brain trauma? It's possible that opioids aren't the greatest option for them. Opioids should be administered with caution in patients who have had head injuries. Careful thought is required since they may alter consciousness and raise intracranial pressure. Now, let's talk about how opioids affect your gut and your genitourinary system. Opioids increase sphincter tone and decrease peristaltic contractions in the intestines, leading to a frequent adverse effect: constipation. In addition to inducing biliary colic-like spasms of the biliary smooth muscle and stimulating the chemoreceptor trigger zone, opioids may produce vomiting and nausea. Possible urinary effects include elevated ureteral tone, frequent urination, and voiding problems. Let's speak about how opioids may affect your skin, your baby's placenta, and your hormones. When you take opioids, the blood vessels in your skin dilate, making you feel hot and perhaps releasing histamine. Opioids given to laboring mothers may easily enter the placenta and have been linked to newborn depression. In addition, changes in hormone secretion, such as lower levels of testosterone and estrogen, may occur as a result of prolonged opioid medication. Finally, we'll talk about coughing provocation, an interesting phenomena that has been linked to opiate overdose. Overdosing on opioids may cause dangerous side effects such as slowed breathing, pinpoint pupils, weakness, and even coma. Mechanical breathing and opioid antagonists such as naloxone are effective treatments. Some opioids, including fentanyl, may paradoxically cause coughing if given before to induction. In some, opioids are powerful pain relievers, but they have a wide spectrum of adverse effects that may affect many parts of the body. If opioid medication is to be used safely and effectively, it is essential that both healthcare practitioners and patients have a thorough understanding of these side effects. Before deciding on opioid therapy, thoroughly examine the risks and advantages. Hello, and welcome to Optimal Anesthesia. If you learned anything from this episode, please spread the word. Take care of yourself and remember that your health is your most precious possession.